Good afternoon, everyone. My name is Nicole Bahina, and I'm with All Chicago, and we're excited to have us all together again today to talk about some updates related to the COVID-19 response for the Homeless Service Division and Continuum of Care. Next slide. So these are not new housekeeping items, but we do have some new people on the call today, so just a reminder, we want to have everybody placed on mute. You are allowed to unmute yourself, so just be mindful of that, that you keep yourself on mute for the duration of today's webinar so that we can reduce the background noise and have an enjoyable experience for everyone as much as possible. We're going to be using the chat box for questions throughout today, and we'll pause during the session a couple of times to answer questions verbally, although we do answer questions in the chat as well. You can also use the chat to notify us of any technical issues. And if you have trouble hearing at any point during the webinar today, we suggest either trying to use your computer audio or switching to a phone number. And you can do that by using the icons on the bottom of your webinar screen and click on the audio function. Next slide.
So before we get into the content about COVID-19 homelessness response, we wanted to take the opportunity to remind everyone that the census for 2020 is going on. It is a very important activity.
Give us 1 second, everyone. Maura, I think we just lost you. We were trying to mute people to reduce some background noise, and now we can't hear you. So 1 second here.
Okay, I think I'm unmuted now. Thanks. Can you hear me?
Yep.
Okay, sorry about that. I'll start over. So before we get into the COVID-19 response portion of the presentation, we wanted to take this opportunity as our weekly reminder about the census for 2020, which is going on now. Last week, if you were on the webinar, Nicole shared some information about efforts to count people experiencing homelessness who are unsheltered being somewhat postponed. And so there will be more information on that, forthcoming, and All Chicago will continue to share that. But for those of you who are working in, housing programs or shelter facilities, please make sure to be connecting as much as possible as your residents to the census enumeration process. There may be enumerators contacting some of our programs down the line to see if they can come to your facilities if they have not already. But just a reminder that filling out the census is really important. It helps us get the federal funds that we need in Chicago for a number of things, including our responses to homelessness. The data are confidential. And we really want to make sure we're getting the word out as best as possible. So thank you for your efforts around this. And we'll continue to talk about this from time to time. Next slide. So today's agenda will continue to share progress about the current COVID-19 response throughout the homeless system and beyond. We'll get some information from All Chicago about things that are happening with HUD and the COC, and really start thinking about questions that we all have about recovery as we start pivoting our planning together and response together to this next phase of the COVID-19 response. And so we'll spend more time on that at the end. Next slide. So I think I gave a quick overview of the agenda in my talking points here, but this is what we can expect to cover today. And so we can go on to the next slide. Next slide. And at this point, I will turn it over to colleagues at the Chicago Department of Public Health.
Yes. So good afternoon, everyone. I'm Dr. Jasmine again. For those of you who are new to today's session, I'm a medical director here at the Chicago Department of Public Health. We usually begin by reviewing the current COVID-19 status within the city. For those of you who haven't had a chance yet, you can also find this information on chicago.gov/coronavirus. It's updated every day. So as of yesterday, there were 28,567 cases of COVID-19, and unfortunately, 1,206 deaths among Chicago residents. This shows an increase of 999 cases and 54 deaths since May 6th. Next slide, please. So we've gotten a lot of feedback about and questions about what our housing solution, isolation housing solutions are. And this slide basically shows that there are two general types of housing, general isolation, and another option which we call supportive isolation. The main goal is to prevent transmission of COVID-19, and it should highlight that it's free of charge to any Chicago resident. So if they're unable to isolate in their homes, or if they're unstably housed or experiencing homelessness, we all qualify for these solutions. The first one is the general isolation or private rooms. This option is meant for those who generally have well-controlled chronic conditions who would not need any additional medical or behavioral health support during their isolation period. The way it's a hotel that's been transformed into an isolation facility or isolation room. And so once you enter the isolation room, it's expected that the person stays in that room for the duration of their isolation period. There are 2 wellness checks by nurses that occur throughout the day, and it's by telephone. They ask about symptoms, and prior to entering the room, you're given a thermometer, and you're asked during the wellness check to report your temperature. We ask if anyone enters that to bring about 2 weeks supply of medications and clothing and toiletries. Some of the toiletries will be provided, but if there's anything special that you feel like you need, you bring it before you enter, because once inside, there will be no physical communication with anyone outside the room. For the supported isolation facilities, it's a congregate setting. And we know those that are experiencing homelessness, they tend to have multiple chronic conditions, and they may also have superimposed mental health needs. So we are guesstimating that the majority of those who are experiencing homelessness will likely need this solution that we have here. There are 2 options. They both provide a similar level of care, and they do have more closer monitoring, and then the behavioral health needs are addressed through telehealth. So a tablet, telephone, we can have psychiatrists or therapists available to address any needs as they come up. If someone has substance use disorder, that also can be accommodated at both sites. Next slide. So you may be asking yourself, what is the eligibility criteria for the quarantine and isolation housing? So the patient or client must have a laboratory confirmed COVID-19 diagnosis. And they should be less than 10 days from symptom onset or less than 3 days or more, afebrile without any antipyretics, and improved symptoms, whichever is longer. Basically, if they hadn't completed their isolation period, they can finish it at the isolation housing facility. And if they cannot safely isolate at home or in another setting. Here, see that we can go to the next slide. So earlier, for those who have been joining us for the past few weeks, the isolation period before was 7 days, with the final 3 days being fever-free. As of last week, the CDC extended the isolation period to 10 days, with the final 3 days being fever-free. I know there have been questions about whether or not it should go to 14 days. So I included this graph today to show that based on studies on whether a culture is positive after someone has been known to be COVID positive, this study was done in a setting where a nursing home setting, and it was covered about 55 people, and it showed that very few people would have a positive culture or have active virus. You see at 7, you see 2 red dots, and then the final red dot appear on day 9. And so I think that's the evidence that's supporting this 10-day isolation period. And of course, if any fever develops during that time, we wait until there are 72 hours or 3 days where the person's afebrile. Next slide. And so what does the referral process look like for people entering the isolation facility? So the ER can make a referral. We are having testing teams go to shelters that have reported 2 or more cases of people or clients who are positive with COVID-19. And so if the testing team, rapid testing team has come to your shelter, once the results are available, we provide nurses to come to the shelter to disclose the result to each of the positive clients, and then to facilitate the transfer process, which involves filling out the central intake form. I'm going to be providing the website for where the central intake form will take place. The purpose of the nurse being there is they'll fill it out the first few times, but it's also to increase the capacity of the staff working at the shelter. So they'll help you, once you've seen it done a few times, they'll also help the staff members fill out the form so they get comfortable with the form, and to make sure that they have the accurate website to pull up if in the future this would be needed again. And so once the central intake form is filled, our intake team begins a review. And so it has 2 levels of review. Once it's first submitted, the social worker, we have a social worker who reviews, and they will call to complete a social work screening, basically to try to have a greater understanding of the psychosocial background of the client being referred. Sometimes that may not take place because we do have some questions related to the psychosocial state of someone on the intake form. So if there's anything concerning, you might get a call for further refinement for gathering information. And then once the social worker reviews the application, then a medical clinician also reviews it. Again, if there's any clarification that may be needed, they may call to ask for clarification. At this point, a decision is made on what kind of facility is appropriate for the client. And so if general isolation is recommended, then we'll work with the intake coordinator at that site to arrange for transportation. And if supportive isolation is recommended, again, we'll work with the coordinator to arrange for transportation to that site. Also, if the person's ineligible we'll let them know, but in this case, we don't anticipate anyone being ineligible. Next slide. And so this is the website where you can find the general intake form. This slide deck, as always, will be available after the webinar. And so you can visit this website. This is what it looks like. You may have also have heard of the state-run alternative care facility at McCormick Place, and recently they announced that they're shutting down that facility. They accepted their final patient on May 4th. So whenever the remaining patients have completed their isolation facility, the McCormick Place, the state-run site, will be on hold. It's still there, it just doesn't have any staff in case there is a need in the future to open it back up. But right now, they're not accepting any referrals. And so here you'll see the options for the supported isolation facility and also the private general isolation rooms. In blue, you see referral form. That's the active link on the website. So just so you know, the actual intake form is the same regardless of whether or not you click it under the supportive isolation facility versus the private isolation. The determination of where the person actually is transported is made in conjunction between the social worker and the medical clinician who reviews the application. Next slide. And so the testing strategy in shelters, I know in past weeks you've also asked about when a testing team will be coming to your shelter. And so if you look on the right side of the slide, it says all clusters are reportable to the Chicago Department of Public Health by using that link, chicagohon.org/COVID-19. On that website, there'll be a form that you could use to report when you learn of any 2 or more cases of anyone who's COVID positive at your facility. It could be a client, it could be a staff member. Once that report is made, it triggers the steps to get a rapid testing team to come to your site to provide testing for everyone on site. And this is done in partnership with Rush University, UI Health, and others such as Longdale Christian to come and organize testing and provide support. And it shows that CDPH responds to testing, responds to outbreaks in congregate settings. So the clients and the staff members, whether they're symptomatic or asymptomatic, they're tested. The COVID positive individuals are transferred to isolation. And that's when the public health nurse that I mentioned in the previous slide, that's when they would come in to help facilitate the filling out of the intake form and then to help with the transport. And then the public health nurses also will provide personal case-by-case guidance in the congregate setting about infection control. And then if isolation is available or possible in the shelter, they'll help provide some support in terms of infection control, best practices for infection control and proper spacing in areas that are not isolation for the remaining healthy clients. So right now, we're exploring a pilot for rapid testing. So these tests can give results within 15 minutes. However, they're not FDA approved, which means that we still need to wait for the regular test results to come back before we know whether or not someone is truly positive or negative. And so the test results, once they come back again, the nurse facilitates the transfer. So for the testing that has been completed thus far, so they're still aggregating the data, and then there are plans to include the reports from all the testing that has been conducted in the homeless shelters on our coronavirus website. So once it's complete, that's where you'll be able to find the report. And I'll also announce it when it's also available on the website, so you know. Next slide. And so here we have two different guidances for those in housing and shelter providers. If you follow these links, you'll be able to find them. Just so you know, for those who are very familiar with the homeless shelter guidance, we are releasing a new version. Much of the information is the same it has, but the look is a little bit different, and we've included some additional information that we had before for like long-term facilities that we believe can also apply in this setting. So when you have a chance, please go visit either of these websites. Okay, and next slide. Is that for me? This question.
Yeah, this is Dr. Jasmine. I think we'll go through the DFSS slides, just have a few, and then pause for questions.
Okay.
Thank you. So as a reminder, we're continuing to take all shelter referrals through 311. As Dr. Jasmine has walked through the QI, the isolation facilities are temporary placements for COVID positive individuals, and we will be communicating the procedure for when they are medically cleared for discharge and how they are referred and transported back to shelter. There's currently slight variations on the process depending on the facility and the transportation availability, and some of our shelters have already received, residents back from isolation and have experienced this, but we want to get the process out to the entire community so that everyone is aware of the process and what to expect when those discharges happen. Next slide. So we are continuing to manage 5 temporary shelters, providing now a total of 700 beds to support the decompression of the shelter system. The Broadway Armory opened last Saturday as planned for single adults, men and women. It's slowly ramping up as we get our staffing capacity online. And so we are now kind of where we believe we will be with our shelter system at the decompression level. We are continuing the coordinated effort between shelters, CDPH, Lawndale Christian Health Center, and so far just around shielding high-risk residents. And so far, approximately 150 clients have been identified and relocated from congregate shelters to individual hotel rooms for shielding. So that still continues as shelters identify new individuals who meet those high-risk factors. We ask that you continue to let DFSS know so we can do that coordination with CDPH and Lawndale Christian Health Center. We did our first wave, but we know new people are coming into the system as well. And again, we're continuing the nursing support out to our shelter programs. Last week, there were some questions around additional shelter programs who were waiting for some follow-up from the nurses, and those visits should have been scheduled for Monday and Tuesday of next week. And we will continue to be working individually with our shelters based on what's happening in your particular setting to assess ongoing need for support from nursing staff. Next slide. And then, finally, we're continuing our outreach efforts and canvassing to screen and support basic needs of individuals who are unsheltered. We are exploring, and I think in the final stages of exploring, the opportunity to expand the assessment and shielding of high-risk residents at encampments. So we hope to have more information about that shortly. And then we're continuing concentrated outreach on the CTA trains, it's happening during the day, but also overnight, just to continue to provide education, offer shelter, and provide face masks and hand sanitizer as we have available to riders who we know are experiencing homelessness on the CTA. Next slide. So I think here we'll pause for questions before going into the L Chicago portion of the webinar. And I'm just pulling up the questions here. There are a few. So Dr. Jasmine, here are some related to what you presented. Could you speak a little bit about how the determination is being made if someone needs the additional supported isolation versus not needing it? You spoke a little bit about it in the presentation, that there's an assessment between the social work intake staff and a medical technician, but is there anything else you could add to that?
Yeah, so conditions like diabetes may require some blood glucose monitoring that may not be facilitated at the private room option, but because we do have nurses available at the supportive housing, we can funnel them to that kind of housing. If someone is, I guess this is more for hospitals, if they needed to complete some kind of IV treatment, they would go to more of the supportive housing. Anyone with a mental health condition will go to the supportive housing. We know that even those who are well controlled with medication, that isolation or just the idea of being diagnosed with COVID-19 can be very anxiety provoking. It may precipitate any symptoms, even though they were well controlled before. And so the behavioral health services are available at the supportive housing facility, and so they can call on those team members, whether they're therapists or psychiatrists or social workers. They'll be available to provide that general support.
Okay, thanks. And then there's a similar question. There's another question that I think is related that you touched on for the supported isolation, but for the general isolation, what type of support is offered to individuals staying there to help them cope with the isolation?
So we do have telephonic help available. So through the phone, we do have the therapists are available by phone. If it's absolutely necessary, we can also arrange for a telehealth where a tablet is used for a face-to-face interaction.
Okay. Then if the shelter is already in queue for testing with CDPH, do they still need to report to through the Chicago HAN website, or should they assume that they're covered?
Yeah, if you're in queue already, so that means we've reached out to you and gave you a testing date when the team will arrive. You don't need to report. It's just for the initial reports.
Great. And then are people who are still waiting for test results no longer eligible for quarantine or isolation housing? How does that work?
It's not that they're eligible. We're not eligible. We're waiting for the results to come in. And so for all positive cases, we arrange for isolation for them.
But as they wait for the results, they remain in the
shelter.
Okay. Okay, and then there's a question here. This is for DFSS. Can we explain how the Broadway Armory is going to work? This is a decompression shelter, so it is not a COVID positive facility. It is operating the same way all of our temporary shelters are operating. So people would access the shelter via 311 and be routed there based on bed availability. It's a shelter that is targeted for single adults of any gender. So it's, if there's any additional information that we didn't cover on that, just add that into the chat, please. But it will be accessible and provide the same type of services that our other temporary shelter facilities are focusing on. And it looks like that is, I'm just going to do one final check, but that seems to be all the questions we have right now for the city presentation. So I think we can move on to the next step of the presentation.
Okay, thank you, everyone.
Thanks, Dr. Jasmine and Maura. Great. So, hi everyone, it's Nicole Bahino with All Chicago again, and I'm just going to go through a few slides today, and this is actually the last time you'll see this slide because we are restructuring a little bit of how we're presenting this information to help it flow a little bit better, and so you might not see this graphic anymore, but we have been focusing on promoting cross-provider communication, maximizing financial resources, distilling and creating guidance, and mobilizing our community's action agenda to support expedited placements into housing. So I'm just going to touch on a few updates. Next slide. So you might be sick of us talking about Slack, but it's here to stay for a while, and it is one of the best ways we're communicating right now to the community. We do send out emails, but we try to put any information we get from DFSS and CDPH and for the COC all in this place. So make sure to check those sites as well, but please connect to Slack. We have a new Slack flyer that explains how to join that Jennifer just put in the chat, and go to the next slide. We can just walk you through some of the channels. So Slack has a workspace, and we have been trying to organize it in a way that I think hopefully will make the most sense based on all of the feedback we've gotten from people who are in there. So we have announcements where just all Chicago staff post here. These are motions, orders, policy changes that are on a federal, state, and local level. Our COVID-19 response channel has guidance. And you can post events at your organization that are COVID-19 related, and so we encourage all providers to post here. We also encourage providers to post in the providers questions section, and I know all Chicago staff frequently respond to the questions in there, but we encourage you all to answer each other's questions as well. And then same with resources. So all providers are encouraged to post here. Things that you might find in there are like the Meals on Wheels flyer or other things that all Chicago staff come across that we find helpful. And then our webinar summary place is where we post webinar summaries from these webinars as well as from HUD and the National Alliance to End Homelessness and any other ones that we feel like has applicable information. And the reason we're doing that is because we know you all are on a lot of webinars already, and if you miss one, instead of listening to the recording, you might be able to just look at the resource, see if the content is valuable, access resources, and then if you want to go back and listen to the recording, you can do so. Next slide. So our housing provider peer sharing webinar for next Thursday is going to focus on the stay-at-home order in Chicago Public Schools remaining closed, and just what are the assistance and guidance surrounding the city's available food and child care resources. So Jennifer just pasted a link in the chat to joining that, and so we encourage people to listen to that webinar as well. And Jennifer, is that one of the webinars we'll also post a webinar summary to? Maybe you could post that in the chat. And if not, we'll make sure there's a recording available. Next slide. Okay, so we've been talking a lot about the COVID-19 Expedited Housing Initiative, and this housing initiative really is really applicable to COC-funded agencies, in particular those that have permanent supportive housing or are helping get people connected to permanent housing and rapid rehousing. So the COC adopted a policy in support of expedited housing at the April 15th 2020 board meeting, and the policy went into effect for COC-funded agencies this last Monday. We encourage you, if you haven't already, to read the Expedited Housing Initiative brief and the accountability plan for more information. And we did ask all agencies to sign in an acknowledgement form to say that you have read the accountability plan, and if we haven't gotten your response yet, we will be following up with your agency if we haven't already. Next slide. So part of the accountability plan will rely on All Chicago's ability to pull data from the system, and so we're going to be looking at bed utilization rates, timeliness standards, the time it takes from someone who is matched to your program until they get housed, and openings that are without match requests. And there is a note here that the timeliness standards in this context refers to updating the needs referral status. It's not the same as data quality timelines. So we'll make the necessary switch in the accountability plan to clarify this difference, but we did want to call it out here. So All Chicago is working on developing these data reports, and then we'll take a recommendation to the System Performance and Evaluation Committee, which is part of our action agenda, to make sure we're pulling the right data and pulling it in a way that makes sense, and then we'll share it back out to the community. Next slide. Something else we've been working on to help the system make some shifts in order to expedite housing placements are working with the Chicago Low-Income Housing Trust Fund and the Illinois Housing Development Authority and CHA. And hopefully by next week we'll have some more information we can share about our work with CHA, but it's been really positive, and CHA is very much on board with the idea of helping people expedite housing placements into CHA units. But we did want to share that the Low-Income Housing Trust Fund sent out an announcement this week. So if you're a partner agency, you probably got the email. If not, you can email us at cocprograms@allchicago.org, and we can connect you to the email so that you have something in your files. But they're temporarily allowing properties to conduct self-inspections for vacant units for new move-ins. So we're hoping that that would expedite the process to get people housed in some way. And then we also received guidance from the Illinois Housing Development Authority that allows regulatory flexibility for self-certification of income, electronic and delayed signatures, delayed income recertifications, and property owners and managers are being encouraged to waive any tenant selection plan requirements that extend beyond basic federal requirements. IDA also committed to us that if you have an IDA property, that you could connect with your asset management contact at IDA for technical assistance and just help doing a deeper dive into what types of things you could do to expedite housing placements in your property. So again, you can email cocprograms@allchicago.org if you have further questions or would like some technical assistance or help with that matter. Next slide. And just a reminder that the Coordinated Entry Leadership Team has taken action to support the Expedited Housing Initiative by implementing temporary prioritization plans and interim contact protocols. And we went through these in detail during the last session, and also All Chicago sent out a notice about them, and you can refer to CSH's website to read more about either of these. But we just wanted to make sure people know they are in effect now. Next slide. Oh, great. So I just basically said the same thing, but you can access the materials from our last week's webinar about these changes, and there is an FAQ available on page 2 of the temporary prioritization plan. And so we're, I think, our coordinated entry lead could not make today's session, but if you put questions in the chat, we can make sure to bring them back to her, and then we can add those in the FAQs and or bring them back at future webinars. Great, and then we'll pause for questions. And I had the document open, but I clicked out of it, so it'll just take me a second to get back in there. Maura, were there any other questions that DFSS could answer?
No, I think I'm not actually seeing any new questions for All Chicago at this point in time.
Okay, great. Yeah, thanks. So we can go forward with the next slide.
Great. So as we previewed last week, All Chicago and DFSS and CDPH are very interested in shifting this webinar to address both our COVID response and to orient and prepare our system for recovery, including all of our COC partners. And so to start us off today, wanted to share some of the key topics that are on our minds related to recovery. And then next are going to shift into a quick process to get your initial ideas as well. So overall, we are interested in a commitment to equity in this process and response. We're thinking about the implementation and sustainability of the expedited housing efforts, which are beginning with high-risk clients, thinking about coordinating and maximizing financial resources from the CARES Act and other COVID response funds, thinking proactively about how to prevent inflow into homelessness caused by the COVID crisis, including streamlining the current process for applying for rental assistance from our city service centers. We're thinking about, what are the ways that we sustain and build on the critical partnerships between shelters and healthcare providers, many of which are newly created during this crisis, but some that have been in existence prior to the crisis and have been deepened throughout our work together. Thinking about how we continue to support this crisis response system throughout the recovery. So thinking about how we are working with shelter partners and our partners at CDPH to keep our shelter clients and shelter staff safe, and working with our partners at our temporary shelter facilities to think about midterm solutions. The temporary shelter facilities that have been launched in this immediate term were intended to be short-term solutions. And as we think about the need for ongoing shelter decompression, we will need to begin to think about, what that looks like for the temporary facilities and our partners who are managing those facilities. So we'll start having conversations about that with those specific partners, but also with the community about what that looks like. And then generally recording the lessons that we're learning from this pandemic for future use. And I really want to highlight that we're talking about how to pivot our thinking from response into recovery, but we all also recognize that we are not doing something new here. We may be layering on a crisis that is health related into the work that we've all been doing collectively. And we very much need to rely on the strength of our partners and the really deep work that we've all been doing for many years to use what we know works, improve what hasn't been working well throughout our system, and use resources that are coming our way to both protect the health and safety of people experiencing homelessness, but also help them move towards to more stable solutions like housing and preventing people from coming into the system if at all possible. So just reiterating that we are not trying to add something new here. but really trying to use our existing COC partnership and processes to really propel this work forward in a thoughtful way as we contemplate what recovery looks like within our system and with the systems that are interrelated with the homeless system. So we want to hear from you about, so you can go to the next slide. We'd like to hear from you about what's on your mind regarding recovery on the topics that I just shared or any other topics. What's on your mind personally and what's on the mind of your organization or, other, just anything really related to recovery. And so first, we want to know what questions you have that should be part of the system recovery thinking. And so we're asking you to type those into the chat. This won't be the only time that you have the opportunity to do this, but we're hoping to get some ideas from people on the webinar today, and then we will record these and use them to shape the recovery conversation on future webinars. And it will also help us inform some of the conversations and planning that we need to be doing with all of our partners. So first, really, what are the questions that you have that should be part of this system recovery thinking? And then if you're with an organization, how has your agency been thinking about recovery? So please start putting those into the chat. We won't be going through and answering those questions today. We will simply be recording them so that we start to get the brain trust of our COC and partners moving, and there's really no possible way we could answer those questions today because we have to work together on all of those solutions. So thank you so much for sharing that information and your ideas. And again, this won't be the only opportunity, but it is our first pass at starting to get some information collected in an organized way. Okay. And I'm not sure if I lost the slide presentation on my screen, but I don't see slides on my screen anymore. So I'm sorry about that if there is a slide and I'm not speaking.
Maura, it's good. I'm seeing some responses coming in about recovery, and so I think we can pause while we're trying to get the last couple slides up and let people go.
Cool.
Mm-hmm.
And, I think the other thing that I'll just add is that everyone should be aware that the governor released the phases of recovery for the state earlier this week. So if you hadn't had a chance to check that out, that's a helpful way to start kind of bucketing some of the phases of recovery that that the state is looking at, along with, using the data and healthcare medical expertise. And also the mayor was planning to release the city's strategy this afternoon at a press conference, which may be happening right now. So, please do check out the coronavirus website on the city's website for more detailed information about that. Oh, someone already posted the media release to that in the chat box. So, so you can get that story quickly. You can feel free to continue adding your thoughts and questions into the chat. I just want to, first thank everybody, all of our partners, those of you who have been on these webinars week after week and doing the work on the front lines, supporting the work as funders, as advocates, as people who have experienced homelessness, as city staff and other, public service employees. This has been a long period, a sustained period of crisis at levels that we have not experienced. And so all of the work and all of the collaboration and ideas that are generating throughout the city, throughout different sectors, and coming together to support response are just fantastic. And from the city's side of things, we could not do this alone. And those ideas and partnerships and all of the information and needs that are shared, along with the success stories that are shared from all of you, really do help inform how we move forward. And as we pivot into a prolonged recovery phase, and we'll be able to talk in more detail about what that looks like as we look at all of the plans that the state and the mayor are putting together and try to piece together what that means for our system. So I think it's a time that we are needing to recommit and re-energize ourselves as best as we possibly can for this sustained response. But we will continue to, provide these webinars and other opportunities to share out information, gather ideas. This will, clearly not be the only venue. There will be working groups throughout the COC structure, that continue the work as well. So, just number one, thank you for all that you've done. Thank you for your continued commitment to this. All of our efforts and resources are going to be important to continue, continue prioritizing the health and safety and long-term well-being of people experiencing homelessness in our system. Again, please just make sure that any communications that come out from All Chicago, DFSS, or these webinars are also shared with all of the relevant staff in your organizations. And as always, especially for our shelters system, please keep DFSS informed about any staffing changes in bed availability, and suspected or confirmed COVID cases, and really any additional support needs that you have so that we can continue to work in partnership with you.
Great, thanks,
and
Laura.
I think that is it for us today.
Yeah. I was just going to say we'll keep the chat open for about 5 more minutes, but people can probably log off at this point because we're not going to share any more information, but we will keep the chat going since there seems to be some robust ideas and discussion going on. So thanks, everyone.